So thank you so much, Isha and Lei, for being here today and taking time out of your busy schedule to talk with us about a very important topic, which is pregnancy and motherhood and all things related to that in IR. So if you guys want to go around and tell me your institution and also your favorite IR procedure, I think that would be a good way to just kick this off.
You want to go first, Lei?
Sure. My name is Lei Yu. I'm an assistant professor at the University of Nebraska Medical Center. I'm an early career. This is my fourth year in practice. So, a lot of people ask what's my favorite procedures, and I think I love almost everything related to IR. I'm truly passionate about IR. I do have to say I have a very special passion for adrenal vein sampling. It's not a very common procedure a lot of people perform, but I love it because it's tedious, it's a lot of unknown, and you could be the most skilled physician, could still get negative results, which humble yourself to always be better. So I found that to be very, very interesting. So I will put that to be my favorite procedure.
All right. I am PGY 6 at Brown University Health, Rhode Island Hospital in Providence, Rhode Island. My favorite procedure, I mean, I honestly, just like Lei, I just love everything about IR. I think it's the coolest thing ever. But if I had to pick something, then that would be, women's health procedures, namely, uh, gonadal vein embolization for pelvic venous congestion syndrome, as well as uterine artery embolization.
Awesome, so cool. And I would say I have limited exposure to IR, but I really love like the more satisfying ones like thrombectomy
Yeah.
for like DVT, and then I really love kyphoplasties too because I think that's just really cool and I like mixing the stuff on the back bench because that's where I live. But anyway, okay, awesome. So if each of you could just quickly explain sort of your like when you had your children and like when you thought about in your career having them, just to give us a timeline, and then we can sort of talk about the aspects that go into having children at each time and if it was like what kind of things played into that.
Yeah, of course.
Yeah, we can start with you, Isha.
Okay. I have one daughter. She is 9 months old. So I had her in my last year of residency, our 4 year. And that was also my ESIR year because that's the pathway I took for, coming into IR fellowship. Um, so honestly, I mean, in terms of the timing, I was really going back and forth as to when to have my baby, my first child. Initially, I was thinking about, after fellowship during the first few years of attending hood, but then I started thinking about the biological clock. Then I was like, okay, maybe I'll have my baby during fellowship, but I don't think that's a good idea because that's probably the hardest year of your training. And it's honestly very, very busy. I mean, that's not to say that some people, do have their, babies during fellowship, even IR fellowship. I know a few people who have had their kids during IR fellowship, but I just didn't feel like that was the right thing for me personally. And then just, our 4 year just felt like the right time because, you're done with your boards, you already know where you're going for your fellowship. There is a little bit of downtime in the sense that you're not on IR the whole time because you still have some diagnostic responsibilities. So just in that sense, I felt like that was maybe a better time to, have my first child. Um, and actually that turned out to be true because when I started my fellowship, she was already 6 months old, and she was already in daycare, and we had already sort of established certain things for her. Whereas if I would have had her during my fellowship, I think it would have been a little bit more difficult.
That makes a lot of sense. Thank you so much. And Lay?
Yeah, so I have two kids. I have an 8-year-old boy and a 4-year daughter. They're wonderful. So I had my first kid, my son, during internship. So I was doing medicine. Well, backtrack. I got pregnant towards the end of my med school, and so had him during mid internship. And then, of course, at that time, I have not completely committed to doing IR yet. So the decision was easy. They say, getting married, having a kid.
Yeah.
So then I entered IR. I decided to have IR as my career choice. Then for the second kid, timing is a little bit tricky because then you do have to thinking about, okay, when should I have the second child? We already know we want one more, and should I do it before I start IR training, more intensively IR training? Should I do it afterwards? So it's a lot of a back and forth. And I do have to mention that a lot of us are fortunate to be able to time when to get pregnant. There's a lot of uncertainty, and certainly a lot of them have difficulty getting pregnant.
Right.
So it's not necessarily at your hands, like, oh, we can plan out when have a child. So my daughter actually worked out. It was COVID. So there's a lot of COVID babies coming out of that special period of time. So I got pregnant with my daughter right before I starting intensively IR training. So I had her during my IR year, which was also very helpful. Actually, when she was already 5 months old when I start the ESIR year training. So everything worked out for me as planning wise. So yeah.
Awesome. So it sounds like both of you had success in planning, and I totally understand that, you can make plans and you can try to perfect it, but you never know what's going to happen. So, but that sounds great that it worked out for both of you. Um, once you found out that you were pregnant, how did you go about making the decision, like when to share this with attendings or co-residents or like faculty? And how did that experience go for both of you?
Yeah, so I mean, actually, my story is a little funny because I got pregnant before boards. And whoever's taken, radiology boards, they know that, you're sort of in hiding before your core. You want to be left alone. If you're, reading studies, you're sort of tucked away somewhere in a remote station. You're trying to just finish your job and, try to go home and study or, go to the library and study and whatever. So I was pregnant during the board review time and just before boards. So because it was early pregnancy, I obviously didn't want to share that news with anyone. But after I came back so after boards, I went on a 2-week vacation. And when I came back, I sort of had a belly. So people were a little like, what happened? A lot of people actually picked on that. Um, some people were respectful, they didn't say anything, but I actually waited until, my anatomy scan, which was, I believe, 21 or 22 weeks, to officially declare it leadership. And, even my co-chief resident, I was a chief resident during my R4 year. So I waited until I had all the check boxes in terms of, genetic screening and anatomy scan and those things. But it was well received. I mean, I had made all these assumptions in my head, but it was really well received. I felt really supported by everyone.
That's so good.
Yeah.
I'm so glad.
So I also have a funny story about how to kind of share the news of pregnancy. That was during COVID. I was at home and I was approached by my chief resident at that time. Say, hey Lei, can you cover IR for a couple days? So I always enjoy doing IR at that time. I'm like, oh yeah, anytime they ask me to cover IR, will be like, raise my hand, yes, I'm willing to do it. And so I actually initially said, oh, absolutely. And then I backthought, I'm like, you know what? Maybe let me check, let me do a pregnancy test. And you know what? When I took the test, it was a positive, which is
Oh,
totally, it is what it is. So, and then I had to text him back and say, okay, sorry, actually, I cannot. So that's how I found out I was pregnant. So then immediately, because of the rotation arrangement, so my chief resident at that time already knew about it. And to me, because I have the upcoming rotation planning, because I was like, okay, I want to make sure I start my intensive II year or month later on when, I'm close to my second term, second trimester. So, and also it's my second baby. So I feel like I already in my mind have more things I want to plan ahead of time. So certainly declare of pregnancy is a volunteer, and you choose your perfect timing for you, works for you, what you're comfortable with. But to me, I feel like I want to have rotation planning way ahead of time. So I notify my program director, the chief resident, and also so that way they can start working with radiation safety officer as well. Just because of my my training were involving a lot of radiation exposure. So I would say in general, I feel very positive and supportive as well. In our program, everybody is very happy for you, and our overall program is very family friendly. We are, I will say, we're very fertile department. We have a lot of babies every year between staff and the residents. So everybody just in celebration mode whenever you share pregnancy news.
that's so lovely because it really is important. I know as more women enter IR, in a space where, sort of pseudo-surgical, like may not have the best track record as far as celebration of pregnancy and viewing it as a positive thing, that I think that's really great that both of you seem like you had really good experiences with that. So that's awesome. And then to sort of touch on something that you were mentioning, Lei, how did it go as far as radiation safety? And I know there's been lots of studies showing that we have great resources to protect babies and moms from radiation. But were there anything that sort of still made you feel nervous, or extra precautions that you took, or resources that you felt like were particularly helpful in just sort of easing your mind about that kind of stuff?
Yes, we as a mom, you always want the best for your baby. So naturally, you would worry about, even though there's data, research, papers, guidelines from different authorities demonstrate safety of occupational exposure during your training or during work. But you always want to be like, okay, can I do more to protect my baby from radiation? So I would really recommend, if you're not familiar with the resources or policy, make sure you're talking to radiation safety officer at your institution. They have all the resources. They will once you declare pregnancy, they will starting to monitor the dosage exposure. So you will wear dosimeter really rigidly. They will send you every month the reading, make sure you are at a safe range. And as for exposure wise, I would say I did a very pretty standard. I People always asking, do I need to double lead? I would say it's there's no evidence to show double lead has better protection. It's not generally necessary or recommended to double lead for female with pregnancy. And we mentioned lead is already heavy and you already physically exhausted all the time and carry a lot of weight already. And with double lead or heavy lead we can induce a lot of physical strain as well. I did a pretty standard, always wear two-piece, cover the belly with a skirt, and then cover top, back, and front, and goggle, eye goggle, and thyroid shell. So all the standard stuff. I would say timing is very important because we all know radiation exposure is one is the time of your pregnancy. It gestational age. The second is the dosage, right? We all can control dosage by monitoring how much exposure we have. I try to avoid, we were in the first trimester with the organogenesis phase, I try to avoid non-fluoral guided procedures. That if you are gonna be there for 2 hours, 3 hours, I would certainly try to avoid that because that's a very short period of time you can control what kind of procedure do. Try to do more like ultrasound guided, CT guided procedure. You can control the exposure or do some procedure with shorter period of shorter procedure time. And once you are enter the second trimester or even after the anatomy scan, right after 20 weeks, generally is considered very safe.
Yeah, I agree with Leah 100%. I mean, honestly, in my case, I lucked out with the timing because my first trimester coincided with board prep and board review, so there wasn't much radiation going on for me. But I do agree that double letting is just going to add to your backache and back problems. I don't think that's necessary. A lot of the studies have shown that it's actually not necessary. You just have to follow ALARA standard precautions, like Lei mentioned, all of those. And then it's not mandatory for you to declare pregnancy, but if you wanted to get a dosimetry report, then you can certainly get 2 badges, one of which is installed inside of your lead, which sort of is that's going to give you a fetal dosage. I personally didn't do that because, like I said, majority of my pregnancy, especially the early trimester, was it coincided with board prep. And after I came back, I had a lot of diagnostic responsibilities. So really, it was only towards the end of my pregnancy where I was spending some time in the IR suite, which again, I mean, I was fatigued from just standing and wearing the lead. But from a radiation safety standpoint, I agree with her that, just standard precaution. Yeah, is great. Yeah.
That's why I also encourage to have early conversation with your program director, chief resident, because there might be necessary adjustment of your rotation schedule or your call schedule to accommodate the safest, the least radiation exposure at a critical period of pregnancy. So I do encourage open that, early conversation with them.
Yeah, that makes a lot of sense. And maybe more of a logistical question. When you were wearing the lead as you got further along in your pregnancy, how did that work about fitting it over your belly? I keep thinking about that.
My goodness. I was actually I couldn't fit into my lead anymore, obviously. So I was wearing a lead that one of the IR nurses wasn't using anymore. But that was sort of this older version of the LEDs that we have now. I mean, the LEDs that we have now are lightweight, especially if they're custom fit. They don't carry as much weight on you. But her lead was, I mean, it fitted me just perfect, but it was this older lead, so it was heavier. Um, I I don't know what it was, but I just could not bear wearing lead more than an hour. I started feeling, sometimes I would just start feeling a little dizzy as well. I don't know if it had some impact on venous return or I don't know, but I just could not, I could not take wearing lead, especially towards the end. I mean, I actually, this one time I almost passed out where one of the IR techs had to physically hold me and had to sit me down. They, put me on a stretcher and gave me like juice and things like that, elevated my legs, and it was the whole thing. So yeah, I have been through that where lead was just, I just could not bear wearing lead towards the end.
Yeah, absolutely. Yeah, the same. Like my lead probably mid-pregnancy won't fit me anymore. Like I have to searching for some larger lead that will will fit my body. So that's quite challenging. And like Isha mentioned, yeah, they tend to heavier just because of the larger, and it can put a lot of physical stress on you. Yeah, I would say, listen to your body. If you are already carrying a baby and a lot of body, return weight, and the leg is certainly putting a lot of pressure. So listen to your body. If you need a break, just say, hey, I need a stool, I need to
Yeah.
take a break.
Yeah, there were times where I have, I've left the IR suite just because I could not stand or bear to stand. I would start having either back problems or just started to feel just, I don't know again if this is proven, but my theory is that I was having some lack of venous return because of the lead towards the end, because it was pressure from my baby, then the lead, and just wearing the gown, the heat and everything. I think just the combination of so many things. You have a mask on. It can sometimes get hot in these rooms, especially if you're standing for too long. um, and again, I mean, these things now, they don't affect me. They didn't affected me before the pregnancy. So I believe this was all related to just being too pregnant, wearing a lead that was much larger than me, much heavier. But yeah, I agree with Lei. Just listen to your body. I did have moments where I felt like, oh, am I weak? Can I not, stand for this long? Can I not do this procedure? Then I started to question myself. You have all these internal, questions. There's internal turmoil because you're trying to do best for yourself, your baby in that situation, but then you also don't want people to think that, you cannot do it. But honestly, I don't think anyone's thinking that. Everyone knows that you're pregnant. Everyone's considerate that you're pregnant, and that just need some time to exit the room, maybe have a sip of water or juice or whatever, and then come back in. My attendings were completely okay with that. So I think you just make a lot out of that situation, but I think most people around you are compassionate, considerate of the situation.
Yeah, absolutely. And I mean, you're doing two monumental things at once, creating a human inside of you and learning how to be an IR doctor and doing all of those procedures all day long, especially and adding lead circumference to you as you're doing it. So I think that's just so many tasks at once. And was there any other way, sort of outside of the IR suite or additionally inside of the IR suite, that you guys helped to take care of your body or take care of yourself mentally while you were pregnant? And also, like, that involves, like, did you have morning sickness? How did you deal with that? Waking up early to go to the IR suite, things along those lines.
So I had an unusually long period of morning sickness.
Of course.
It just never went away. So all the 39 weeks, 5 days that I was pregnant, I had nausea and vomiting. So nothing made me feel better. All all that I could do is just throw up, and that would sometimes, make me feel good temporarily. Some foods would make me feel good temporarily. But I just sort of learned to live with the nausea. I was taking meds for that throughout the pregnancy. I actually had a we in my residency, there was a fluoro suite that had a bathroom attached to it, and everyone knew that if Isha is missing, that's where she probably is. She's probably throwing up in that bathroom. So yeah, I had a very difficult pregnancy from that standpoint. Everything else was really good, but I mean, even during my radiology boards, all 3 days I threw up. So again, I mean, I was just really glad that we were able to take it from home. So nothing made me feel good about, whether it was being in the IR suite, out of the IR suite. It was just nonstop nausea and vomiting for me. But I think that's just a unique situation. Most people, I think they're able to get over the nausea after they pass first trimester. And for me, it was that's just the way it was. So
Wow, I can't imagine. You're such a warrior. Oh my gosh, especially during
I
your
know yeah, I cannot imagine that. That gotta be so hard.
it was
Yeah.
tough. It was tough. I mean, sometimes now that I think about it, I feel like I don't know how I was surviving, but
But
we.
you made it. Yeah. So actually, I would say I lucked out. My pregnancy has always been super straightforward. I don't have didn't have much complication or difficult situation. I would have said because the flu retention at the end of towards the end of my pregnancy, like my feet will be so swollen. So literally it's funny because I will just randomly after my procedure, standing for a long period of time, and I will just show everybody my feet and everybody just think it's so horrifying because literally like so swollen. And I just take it as a fun thing to show people to like, oh, look at this, this looks horrible. I do have a lot of craving during my pregnancy, so it is another thing is you have to balance. You cannot eat too much because you have to worry about your glucose level. You might not passing the glucose test, but also you have all sorts of like different craving. And my special craving was churros. So, and in Nebraska, it's hard to find places that sell churros. So my husband would drive in the car and go down all the Mexican restaurants to find me some churros. So yeah, it's fun. I would say, it is very challenging to have a baby, carry a baby and going through all the physical challenges. I believe there's many women out there has went through a lot of difficult pregnancy, and you might have other responsibilities, right? You're taking care of a patient. It's like your personal, unwilling feeling is not gonna stop you from being a provider. So it is really, really, really awesome of our physicians to go through pregnancy and do all the amazing things and overcome all the difficulties we're facing.
Yeah.
Absolutely. I agree.
And along your journey, was there, ever a time where you encountered bias or assumptions about your commitment or your future plans, or was there any sort of sticky situations that you got in, and how did you manage that?
So two comments that actually stand out, and whoever's listening to this, you know, hopefully you're not one of those people who think this way, but one of the comments I got was, oh, great, you're gonna get a 6-week vacation. They were talking about my maternity leave. And I was just dumbfounded because I was like, I don't think that's a vacation, but I didn't say anything to them because I just felt like I just needed that comment to pass. Then another time somebody else said to me, oh wow, you're still continuing IR after you had your baby. I didn't think you would. So I mean, things like that, I think we don't have enough women in IR. So for me to, I didn't actually have a role model, like a female physician in IR to look up to, or, ask out for help and things like that. So um, whenever there's an opportunity for you to do better in that sense, where you want to support, other female physicians, I think whoever is listening to this, please do a better job. Comments like this, where you say that, oh, I didn't think you would continue in IR after having your baby, they don't help because, you're already going through a lot in life with the new baby, trying to find your feedback in the IR suite, trying to juggle all these responsibilities of a new mom. I lucked out because I have a very great support in terms of my male IR attendings who are truly wonderful. I have a wonderful partner. My parents, they're all supportive. So I was able to snap out of these, assumptions and bias regarding my situation. And although these are, just sporadic, one person commenting here and there, but that stays with you, unfortunately. You think, I mean, I'm not still thinking about it, but I remember, that someone said that to me. So yeah, I think, you whoever's listening to this, you know, just support the mamas out there who are trying their best. IR is a tough job, as we all know, and we're all, doing our best here.
Yeah. That's why I think it's absolutely important to have advocates in our specialty. So for me personally, it was very fortunate while I was considering this IR journey. We have a female faculty in our IR section, and she encouraged me to think about IR. Said you're gonna be great with IR, and she had a lot of mentoring because I talk about okay, she has two very successful children, and she balanced a lot between work and raising kids, raising family, and she has done a fantastic job. So by saying that you have a role model who did it all and very successful, adds to a confidence of like, okay, I can do this. So by that, I have not had much negative. I mean, I'm sorry, Isha, that you experience that because that's absolutely, when you physically experience a lot of changes, and those comments certainly not encouraging at
They're not
all.
helpful, yeah.
No. Yeah, me personally, I would say I was very lucked out. My immediate working environment, everybody's been very supportive. Another helpful tip is, inevitably we will when you go through go to your maternal leave, somebody is gonna have to share your workload, right? Like IR, we also have call, we have a rotation coverage, so somebody has to cover that area for you. I would say always be proactive. That's also another thing I communicate early is like communicate with the program early on. So they have a plan of adjusting the rotation to accommodate your estimated, maternal leave. And so that way they will have already in place plan of who's gonna cover. So then people who is gonna cover that week will be not like, oh, I'm covering for this person. Instead, that's what the plan was already. Also, we have, multiple residents, not only IR residents, multiple residents will have pregnancy or having baby, even our male residents, right? They're building on their family as well. So it's kind of like you will take a parental leave at some point of time during your training. So people kind of have this mindset of we supporting each other when they needed the help the most to foster this like supportive environment. And so I think that's really helpful, and it's communicate really well.
Right, that's really important. And Isha, I'm so sorry. Those comments are not appropriate and not helpful and have no place in IR or in medicine in general. But I'm really glad that you were able to know that they have no place and get over that as well. Um, to kind of touch on something that you said, Lei, about the parental leave, how did you go about schedule or like thinking about how long you wanted to take? And was there anything, since you guys were both in residency, was there any concern about having to extend residency, or was there any like restrictions on that?
Yes, so I would say time has changed since the policy when I was pregnant to now. I think overall, the whole entire medical society is moving towards policy more family friendly. So
Mhm.
ACGME actually have the new policy coming out since 2022, which is providing all the residents, all the trainees 6 weeks of paid leave, and that's effective through the day they enter the program. So that has been a great change, and that applies to both maternal leave and paternal leave. So I think that's a very positive change. I would encourage everybody to take the advantage of the new policy change because it's really important those time leave for you to recover, physically and to bond with the baby, and also to recover emotionally. As far as I would say, different institutions have a different policy with regarding, if excessive time off, we're gonna extend your training. I think that's all. That's one important question all the trainee care about. How much time should I take? And would I have to extend my training for this? So in addition to the ACGME policy of 6-week paid parental leave, there's also the FMLA 12-week unpaid leave coming up, right? So that's a different bucket of time leave within this situation. So I would say, because different institutions have different policy, certainly talk to your program director, your program coordinator, to figure out what's the institution specific policy on that, and advocate for yourself, be familiar with the policy. So that's things you can take, and then figure out the minimum requirement, because if you take paternal leave or parental leave, 6 weeks on top of if you take vacation excessively, or if you also have like sick leave, right? Some people unexpectedly could take a big chunk of time of sick leave. With everything combined, that could eventually affect your training. You might have to extend your training for this specific reason.
Mm-hmm.
Yeah, so I had 6 weeks off for my maternity leave, and that was paid. But like Leah was saying, if I needed more, then it would have to be FMLA. And that would have potentially, extended my training. Since I was also an R4 year, that would have also pushed my fellowship further out. But in addition to 6 weeks, I also had 3 weeks vacation and 5 personal days. So I had sort of that leeway in case, I needed to go over my 6 weeks of my maternity leave. Then I had, a couple of weeks from my vacation as well. In the end, I ended up taking, 6 weeks altogether, and then 2 weeks after my boards. So that's how, and I had taken 1 week earlier in the year.
Gotcha. Okay. And when you came back from leave, how was that experience? Did you feel ready to be back at work? Did you feel like, oh my God, I don't know how I'm gonna get through the day. I just need to be back home with my baby. And then physically, did you feel like ready to get back to performing the tasks of IR?
Yeah, so physically, I mean, I was ready to be at work at 4 weeks, because I'm just the kind of person that I cannot sit, in one place for too long. That's just my personality. But I still remember my first day back, my drive to my residency, it takes me about 35-40 minutes. And I just kept thinking, why am I going to work? Why am I doing this to myself? Why is this happening? And but honestly, once I was back at work and doing the things that I love, um, I was really happy to be back at work. Of course, I was missing my baby. So then there was this component of mom guilt as well, that how am I enjoying being at work when I have a baby that's, 6 weeks old at home. So that started to kick in a little bit. But again, I lucked out in terms of my support system from my husband, my parents, even my in-laws. So, when they say that it takes a village, it actually does take a village. You need a lot of support system. I mean, we also had a part-time nanny that was coming in for a couple of hours to help us out. Then she started daycare at 3 months. So I feel like whether it's 6 months, 6 months, or excuse me, 6 weeks or 6 months, or even a year of maternity leave, I think the first day back, the first few weeks back are always going to be tough. No matter how much time off you take, the first day you go back to work, you are going to feel You're going to feel sad. You're going to have all these questions. But I was just, after I found my feedback at work, I was just so happy to be back at work, to be able to, you know, do the work that I love. So yeah, that was my experience.
Mhm.
So circle back to earlier question. I think we kind of touch about paternal leave, parental leave, but one consideration I think people also have to consider is because not infrequently our residents or trainees will have more than one babies during
Yes.
residency. So you have to strategically planning out how much time you're taking off for each pregnancy and how would that affect your graduation? So I just want to bring up that as well. Um, yeah, for me, actually, I was craving adult interaction. Uh, well, I was home with my baby because there's a lot of time you, of course, like newborn is adorable. You want to spend most of the time with your baby, but also you are a lot of time by yourself. Like my
Mhm.
husband had a 2 weeks leave and then he went back to work. So a lot of time just home with baby and you might talk to your friend periodically. I was craving for interaction. So when my maternal leave time is off, I'm like, I'm ready to go back to work. Yes, and I agree with Isha. You have this mom guilt, like, oh, I wish I would spend more time. I wonder what my baby's doing. But knowing that she is at a daycare and having a lot of friends, and they take a really good care of her, it makes it really easy for me to perform well at work.
Hmm. Yeah, I definitely see both of those where it's like you're craving your normalcy and your job. And from my experience, a lot of IR doctors are very passionate about their work and sort of live for their work. And so it's very odd for them to have that take a back seat to something else. And especially in medical training, you've been doing that for so long. And but at the same time, you have this whole other part of you now that your attention and your brain space is devoted to. So I totally see how a lot of emotions.
Yeah. I don't think there's a standard answer. Is like, oh, is how much time is too much and how much time is too little. I think it's all you do you, like what feels right for you is the best for you.
Absolutely. And I also wanted to talk about, I know during pregnancy, there's a lot of doctor's appointments that you need to go to. Was that technically difficult to figure out and manage that throughout the pregnancy?
Yeah, so I mean, post-COVID, a lot of your visits are now televisits. So not every visit is an in-person visit, which is a game changer. But logistically, for me, it was a little difficult because my OB's office was 1 hour away in Boston.
Mhm.
So that would mean that I had to always, leave work at a certain time, and then most of the times I couldn't go back to work. But again, most of my visits, apart from the ultrasound visits, thankfully, they were all televisits. And these appointments are, literally 2 to 3 minute long. They're just like, is everything okay? Okay, everything's okay. Great. Bye. See you next time. I mean, I don't know if Leah had a different experience, but most of my, appointments were just saying hi and bye and just essentially just checking in on you.
Mhm.
So I was glad that a lot of them were televisits.
That makes sense.
Yeah, I feel like I did not have any trouble of getting time off to going to my appointments. We all know they are important. Like you have to take good care of your body, your baby, and it's just communication, right? People also a healthy working environment will have the expectation of like, oh, you need to go certain time for your check. Some are longer. For example, the ultrasound scan, or some will be shorter. Just have a good communication with them at what a period of time will be gone. And they just try to make it up, right? Like we don't want to just dump work to other residents, or also we don't want to missing out learning opportunity. So if you just let them know what time you're gonna leave and planning out. If there's a value for you to coming back to work, and I will always come back to work and just throw myself back to work again. And also just for a really, really friendly relationship with everybody. Don't feel like it's inconvenient. You need to advocate for yourself, because if it's sometimes I feel like it's not people don't it's not people have a negative opinion of you going. It's people actually don't think much about it than yourself. You might think it's okay, I'm inconvenient, and I think people will think of me lacking of, slacking at work. No, people don't think that way. People have expectations. They might not just say, "Oh, so glad you're going to the appointment," right? They're just not gonna show much emotion about it, but they understand you need to go. So I would not feel like embarrassed or inconvenient to do any of that. Actually, I have a funny story. Like I told one of my coordinator, "Oh, I need to go to my appointment at a certain period of time." And then the case was going on really well. And I was like, "Oh, I want to keep going, doing more." She actually called into the room and said, "Please tell Lei she needs to get out and go to her appointment now." So I'm like, "Okay, fine. I'm gonna be like, it's so much fun. I don't want to leave, but I have to go." So that's really, a supportive working environment. People looking out for you. People want the best for you.
Yeah, absolutely. And I mean, I also think of this like if anyone else was going to a dentist appointment or other, PCP appointment, you wouldn't think twice about it. You'd be like, yes, you need to go. So, this is
I agree
really,
with Lei. I don't know if this is just because you're pregnant, you start to think that people are going to think less of you, or they're gonna think that you're slacking. But honestly, no one's thinking that. It's all these emotions are running really high during your pregnancy, and you're just thinking that, oh my goodness, I'm taking time off to, go see my OB or going to an ultrasound appointment. But no one is thinking that. I mean, I don't think about other people when they're going to the doctor's appointment. I'm 100% sure no one else is thinking that about me. But also to her point where communication is really important. If you make sure that if you're a trainee, your attending knows at the start of the day that, hey, I have to leave at 2 p.m. or 3 p.m., whatever, for my doctor's appointment. They will make accommodations. The entire staff will make accommodations. They will know in advance that you have to leave. So it's not a last minute thing. So yeah, communication is really important.
absolutely. So, sort of switching gears to talk about when you came back from maternity leave, how was your thought process, or what did you end up doing as far as breastfeeding, pumping, formula? Was that something you thought much about? Did going back to work factor into that decision? And sort of how was your experience with that?
Yeah, so I made a very conscious decision to start weaning off of breast milk towards the end of my maternity leave, because I knew that my schedule in IR would be erratic. And if I said that I had 8 a.m., 10 a.m., 12 p.m., 1 p.m., whatever that pumping schedule, I knew that that wouldn't work out. Because you just never know that, a case that starts at 8 a.m. would end at 10 a.m. for your pumping schedule. That would mean that you can certainly exit a case, you know, do your pumping and come back. But that was just a personal choice that I made, to not, to wean her off and, transition her to formula, and not pump at work. And it was for this reason that, I mean, and whoever has pumped, and if you miss one session, they would know how hard it can get, to try to pump afterwards and get over that feeling of fullness. And it's just very hard to maintain a schedule when you know that things in IR can be erratic.
Mhm.
Yeah, I would say it's totally a personal choice. There's no right or wrong answers to this. So I didn't have a very good breastfeeding or pumping experience with my first son. My first kid that was in was, inexperienced, so I think I did it probably up to 3 months, and then I was like, okay, that's it. But for my second one, since I have a little bit more experience and I know that kind of might be my last child, so I kind of want to go have a little bonding a little bit longer. So I did try to breast pump during my IR rotation. So I just make what it work. I usually would be doing a case and try to timing myself. If it's just, smaller cases, I might do 2 small cases and then go pump. If it's longer cases, I make sure I pump before. It is quite inconvenient. I don't think people has any comments on me being gone for pumping, and there's absolutely no negative comments or even people noticing, oh, she's gone again. I think overall I receive supportive effort on that. It's more of like inconvenient for us, right? You like have to carry all everything, have to wash a million of bottles, and but it's actually really fun because when I was in the pumping room, there's other residents in other specialty I work with, and we were pregnant at the same time, and then now we're pumping. So it's kind of like social hour for the mom pumping stuff. I would say our institution did provide very good facility, so accommodating for pumping. So I'm grateful for that. So yeah, but absolutely it's personal choice what works for your body, what works for your working schedule.
Oh my gosh, that's really sweet, like an extra social support
Yes.
while you're pumping. But it's great to hear that both of you kind of had different experiences, and in the end, your children are happy and healthy, and you
Yeah,
made
and
the
that's all
decision
that
there.
matters, it doesn't matter if you're 100% breastfed or 100% formula or doing a mix of things, whatever works for you and your baby, just
Yeah.
do that. It's a very personal choice.
Absolutely. So, is there anything that you would want to tell program directors, faculty, or institutions um, about how to make a more family-friendly environment for trainees?
So just in terms of support, and um, having certain things in place, like for example, in the last few years in my residency before me, no one else was pregnant, so I didn't really have a lot of information. I had to sort of go to different places to try to extract that information. So if there are resources in place, whether it's the HR, whether it's the leadership who can talk to you about how much time off you can take, FMLA, whether XYZ would affect your graduation, how much time off you can take, things like that. If there's someone that can explain these things, and also from resident perspective or the trainee perspective, if they can, even before they get pregnant, if they sort of have an idea so that they don't get blindsided after they become pregnant, that, oh, I didn't think about these things. And then it can start to become overwhelming. So just having these resources and support system in place, I think it's important from a leadership standpoint. And that can mean that it's any one person. It doesn't have to be, a certain person in leadership role, even if it's, a person in HR that is knowledgeable about all these things. That's one thing. And then having a place for the moms to be able to pump, so lactation suites, I think that's important as well. Um, and just having a supportive environment, because it's having a child is one of the most natural things. Everyone has it at some point. I think it's just the timeline that differs, but just having mental and emotional support, and for the trainees that are going through this period, I think it's really important.
Yeah, I think program director or the GMA office really should advocate for our trainees. when they're going through pregnancy, the process, which kind of a lot of Esha has highlighted on policy, right? Make sure we have a policy, institutional policy, departmental policy in place. Make sure they are aware and it was delivered to our trainees. Make sure we have a counseling, we have mentoring. Sometimes those are sensitive subjects, and make sure we have not only the program director but female faculty in the department or peers, right? Residents who have been through the process, so they have somebody they can point to when they need help. And it just overall have a supportive environment, make considerable adjustment to rotation to accommodate for our physical needs and also for paternal leave needs. Overall, I think a happy residents, happy it will speak a lot about the quality of the institution and of the program. So it's one of the most, I would say it's one of the most beautiful thing is to being a mom and going through pregnancy with training. During my training, I was very proud of that. And certainly with a very family friendly environment coveted by the department. It's very important for us going through that journey.
Absolutely. That's
I would just add that, sorry, I would just add that even I think my overall experience was just phenomenal in terms of the support that I received in my residency. Not just the leadership, but even my, IR staff, the IR techs, the nurses. I mean, the lengths that they were going to accommodate me during the pregnancy after I came back to work, after childbirth, phenomenal. I wasn't expecting that, but I was just made to feel so supported. And I truly believe that, whether it's trainees or attendings, whoever it is at workplace, you need to be able to feel that because it's one of the most beautiful, but also one of the most vulnerable phases of your life where you're just going through a lot. And especially if you're in interventional radiology, it, adds maybe 100 times or maybe more. So just having that supportive environment just goes a long way.
Yeah. Also, I want to emphasize the support that's not only coming from your department, right? Like you could reach out to other institution if you know anybody, a mentor in other institution or even society, right? Like we have a women in IR at SIR, and we have the pregnancy tool, which we're working on a lot, which give a lot of valuable information for our trainees seeking of pregnancy or information on pregnancy during their training. Another thing comment on is just advocate for yourself. If you feel like there is no policy or no information in your institution, go ask them. Say, can we have some policy? And so make sure they make policy, because you're not only doing for yourself, you're also doing for the upcoming trainees in your institution. Because if you don't feel like there's enough information, enough help, enough support for you, they will not have that either. So you might be the first person to ask for the policy, to ask for the help, ask for the support. So people coming after you will have a better, have a better situation.
Absolutely. As someone who is younger and not yet pregnant, I really appreciate the people in my institution that have gone through this before me. And I think will make a world of difference for me and for everyone else that goes through. So I guess this kind of ties into my last question I have. Is there anything that you would tell a trainee that you wish you knew before you got pregnant about your experience, or any advice you would give?
Do you want to take it firstly?
That's actually that's a big question. So one thing I think it's very important, a lot of people didn't realize, is you need to arrange childcare really, really early on. I would say once you know you're pregnant, the first thing you probably want to do is to secure a spot for childcare. It is so important for our trainees because a lot of us, financially might not be able to afford a nanny. Your family might not be close. So you really need a secure spot, like you can trust your child with, and so you can go back to training. So a lot of times, especially after COVID, a lot of childcare places have a very long waiting list. So you really wanted to looking out for the information. So I was keep thinking what piece of advice I would give to people. I would say that will be number one. Make sure the day you're getting pregnant, find out you're pregnant, looking for childcare options.
Yeah, that's practical and so perfect. Thank you.
I agree with that 100%. I did not know that, or my husband and I don't know what we were thinking, but we were like, okay, fine, we'll just find a daycare. We got lucky that a daycare near our apartment just had an opening because someone backed out. That was the only way we were able to secure a spot for her. So she was born in December, and we were like, after I think she was almost 4 weeks old, we were able to secure a spot. But that's unusual. So agree with Lei 100%. As soon as you find out you're pregnant, maybe start calling daycares, start touring them, and secure a spot. And then an advice that I would give a trainee, especially a trainee in IR, you know, everyone has a different timeline. No two people will have the same timeline. So if something makes sense to you, do it. So if that means that having a baby during your R4 year makes sense to you, do it. If it's before, do it. If it's after, whatever works for you and your family and your support system, do that. I don't think there is any ideal timing. The things that I took into consideration may not mean so much to somebody else. So every individual's situation is absolutely different. You have to take into consideration so many things. Of course, biological clock is one, financial situation, what part of, whether you have support system, physical support system or not, that also weighs into a lot of people's decision making. So again, just do whatever works for you, because in the end, you're the one taking care of the baby. So it just whatever works for you. I don't think there is an ideal or a perfect time. You have to make it an ideal or a perfect time. If you keep waiting for something to become an ideal time, if you say that, oh, after my boards would be, the best time, or things will get better. It never does. So whatever situation you're in, and if it makes sense to you at the time, I think that just would work out for you.
Well, thank you so much, both of you, for taking time out of your schedule to be here, and also, most importantly, for being vulnerable and sharing all these incredibly personal details of your life. I hope that this can be a resource for all of us across institutions for many years, so that people can have a smoother journey and accomplish the goal of being both mothers and our physicians. And so I really appreciate it so much. Thank you.
Absolutely. Thank you so
Thank you,
much.
Mary. Thank you for inviting us to give the opportunity to talk.
Of course.
Thank you.